So
You can hear me okay, right? The quality of the audio is good?
yeah. So, Dr. Tham, what inspired you to pursue medicine?
Right, yeah. Hey, good morning, guys. Thanks for the question. I started university, my university years, actually interested in computer science. In grade 12, actually, I was in the science fair competitions, and I did a project on ray tracing. Nowadays when we play video games, you got NVIDIA, RTX, graphics, GPUs and stuff. Back in those days, of course, this is in the late 80s, we didn't have that kind of processing power, so it took days to just render one screen, one relatively low resolution by today's screen. So my science fair project was on that. And I won for the region in southern Alberta, so I got to go to Newfoundland. And it was actually, in the Newfoundland Science Fair that I thought, hey, maybe I wanted to do computer science. And I actually worked in computer science research actually for the next couple of summers from high school into first year university. And while very stimulating, I actually learned two things about myself there. One, that I wanted to work with people. And two, that working with computers actually kind of killed one of my hobbies. I'm a kind of geekish, electronics kind of guy. So for a career choice, I couldn't do that, long term. So second year university was when I seriously thought about going into medicine. I was already interested in biology. I was in the faculty of science. So I started volunteering in a hospital, spending time talking to a friend's dad who was a medical researcher. Talked about this with my family doctor. And by the end of the summer of second and third year, I actually started working in biological research in one of the labs. What I love about medicine is that it is a practical embodiment of what it means to combine science and art. And I think that's ultimately what drew me to it, to be able to do something to hopefully reduce the suffering in others, one person at a time, getting to know them. Obviously, there are many careers out there that I think I probably would have been fine with and would give me a lot of challenges, being able to meet interesting people, being a better person myself, to appreciate the breadth and depth of life. But medicine has this noble tradition of service that I thought would be fulfilling in my university years. And indeed, nowadays that I've been working for more than 20 years, it's really come to pass, and I'm really quite happy with this choice.
All right. Could you walk us a bit more through your medical journey in medical school and residency?
Yeah, absolutely. Well, I'm here in Vancouver now, but high school and undergrad was actually in Calgary for me. I started science at the University of Calgary, and because I was always interested in science, mainly biology and then this other technology side, I got into the general science program, but was deciding, I guess, between computer science and microbiology. As I mentioned, after second year, I was pretty clear I wanted to go into the biology side, so I wrote the MCAT by the early third year, I think, at U of C. And I guess I did pretty well. My kids are now, in university, and one of my son's classmates asked me a few months ago, how I did in MCAT because he's interested. And to be honest, I don't even remember. But I guess I did pretty well. I wanted to stay close to home, so back in those days, as a third-year undergrad, it was pretty rare to get into U of C, which is a 3-year program. So I applied to Edmonton, U of A, which is a 4-year program, and I got in. And then so I did the 4-year MD program. From there, I was fascinated by mental health and the brain, which is like the most powerful computer, I guess. And then I came back to Calgary to do my 5 years in psychiatry. Just as computers have both kind of a hardware, have that computer hardware and software component, I was fascinated by the intersection between brain disorders and diseases. So I came to UBC to do the 2-year clinical neuropsychiatry program, which is a subspecialty that merges thought and behavior and feelings with that organic side of the brain and brain diseases like seizure disorders and MS and strokes, dementias. And I've basically since stayed here since 2002 when I finished the fellowship program. It was a long road, 3 years undergrad, 4 years med school, 5 years residency, 2 years fellowship. So if you add that all up, that's like 14 years after high school, right before I finally hung up my shingle and had my office going. These days, I'm mostly at UBC Hospital on campus, although I work at other sites depending on the day throughout the city.
Is there anything you wish you knew before you started medical school?
Right. Yeah, very interesting, important question because, you know, um, uh, when it comes to, uh, uh, and it's a hard one because if you want to do medicine, right? So you're asking about before starting medical school, right?
Yeah.
Yeah, yeah, that's a hard one because if you want medicine, that day that you got your email or letter or phone call that you got into med school, at least for me, and I'm sure for others getting into other professional programs, this is one of those special formative days where you have an inkling that the tree of life for you is at the beginning of a unique path. I don't think knowing anything that I know now would have changed anything for me in applying for medicine because, I've been very happy with my career path. And let's be honest, not everyone who gets into medicine is. There are those who leave. There are those who decide that there are other pursuits that they want, once they're in medical school or even, clinical clerkship or residency. What I would say is that medicine is hard, and that's one thing that I would not have known, before getting in. There are long hours of study, of course. There's this interesting shift in the middle of medical school when you go from, being involved in didactic lectures and discussion groups to actually seeing real patients in the clinical setting. That can be quite stressful. You will come across situations when you're managing a crisis as maybe the only resident on your service in the middle of the night and a patient crashes. The first time that a patient that you know well dies will be something that you will remember. For us in psychiatry, when patients commit suicide, these things happen. And I remember, especially being quite affected in my medical school days when a baby died in my pediatrics rotation during my clinical internship. When you're on call, and spending, sometimes every 3-4 nights in hospital, that will put stress on the relationships that you have. And I think there's something to be said about knowing oneself and your emotional makeup in all of that. Accept and expect that, that work-life balance will be shifted to the work side for a few years for most of us, I think, in order to seek that clinical excellence in yourself. I would have been fine with knowing that, before starting med school, and I think it's something to always keep in mind.
How do you handle that kind of loss, like when you lose a patient?
Yeah, well, you've got your colleagues, you've got your preceptor. Hopefully, you've got your family and close friends that can be helpful. In psychiatry back in the day, and we're talking 1970s, 80s, psychiatrists, interestingly, as part of our training, always had a therapist ourselves, kind of going through that process and feeling what that's like to meet a stranger and learning to open yourself emotionally in sometimes vulnerable ways to talk about the areas that you might not have told anybody else in this world. There's an almost confessional component to it that's extremely powerful. And certainly in the religious world, that confessional component is powerful. Not to say that's necessary, absolutely, but I think as a doctor, when you do meet with these crises in life, and you will, in clinical care, you will meet many, many that other people in this world will not experience perhaps in their lifetime. It's good to have that kind of resource, right, to be able to share. And that's how you get through it. It's like getting through grief and loss. And I think that's also one of the great things about medicine. You'll see things and hear stories that I think, most people going through life will never hear. And it's a privilege as well to be able to share that difficulty with others.
So you talked about a lot about like the difference and shifting you've had to make. How do you think you were able to adapt to all these like shifts?
Adapting to shifts? Well, I don't know. I guess I'm a pretty adaptable guy overall. When I was thinking about that question earlier about how I got into medicine, and I mentioned I was in computer science and all that. Honestly, I've always been amazed by those people that get into medicine that tell me I knew from junior high school, like grade 7, grade 8. That I wanted to go into medicine. I knew because I had this event happen in my life where that, my dog died and I wanted to go into veterinary, or, I was in a school ground and a friend broke his leg, and I knew from that point I really wanted to set bones. That never happened to me, honestly. I've always seen life as something that's kind of organic and grows and opens up opportunities. And hopefully in knowing oneself and what one is interested in, you'll grow into the taking on those opportunities, even if you never planned it and foresaw it before. And so it is with my life, right? Like, I thought computer science was going to be great, got into it, gave it a try, realized, no, this is not for me. That's too lonely, too without contact with people. Get into medicine and, get interested in the biological systems and such. But even there, I initially, before, selecting residency program, before psychiatry, I was actually thinking of maybe pulmonology, lungs, maybe gastroenterology, GI, doing scope, maybe radiology. But I decided on psychiatry because of, those other interests that I had. And that, again, was not something that I was planning, towards going into, mental health, the brain, how people thought. That was, so much more interesting. So I don't know. I guess I adapt by just, finding what in myself seemed the most interesting and appropriate, and something that I can add.
Could you give us a summary on your work as a neuropsychiatrist, and what does your typical day look like?
Yeah, okay, sure. Well, every day is actually a little bit different. So I'm not sure there is actually a typical day, right? So my Wednesdays are way different than my Mondays, for example. So without going to the gross details, I work with both inpatients, so those are patients in the hospital, as well as outpatients, visiting people online, telehealth, or they just come into the hospital in person. 75% of my time is basically spent doing this kind of clinical work and seeing patients. And as part of my clinical duties, I do interventional psychiatry, so I'll do things like electroconvulsive therapy. There are other neurostimulation kind of treatments that I do as well. And in the last few years, I've been starting up a ketamine treatment program at UBC, because there's also, this very interesting topic of psychedelic drug treatments these days in the last 5 to 10 years. The other 25% of my time is kind of a mix of administration, because doctors, we don't come into it usually thinking about it, but doctors do need to have a voice when it comes to leadership in hospitals, as well as the teams that we manage. And then teaching students various levels, and then also research, right? Because hopefully we'll be able to understand the disorders better, and especially when it comes to treatments, we've got to make sure that we're on the right track, with our therapies. So the bottom line is that I don't think there is a typical day. It depends. And let's just say it's also not a 9-to-5 job for me, right? Many days are actually more like a 6:45 a.m. to 6:30 p.m. kind of thing. Then there's being on call on weekends and nights. So just be prepared, right? Like this is not the kind of job you walk into if you really want to, immerse yourself.
Can you tell us more about your ketamine program that you've created?
Yeah, sure. Ketamine is interesting because it came out in the 1970s, and back in the 1960s with the Vietnam War and the war veterans and such, the government of the United States was very much against psychedelic medications, right? Psychedelic drugs still are. I mean, it's still not legal, for example, to own it, to use psilocybin, magic mushrooms, for example. But they shut down all of the psychedelic drug research along with criminalizing psychedelic drugs back in those days. Ketamine seeped through that in the 1970s because it is an anesthetic drug. One of the interesting properties with ketamine is that it does have psychedelic type properties. Dissociation, the person's mind feels like it's floating or leaving the body at times depending on the dose. In around 2000, it was found that using some of the research back in the 80s and 90s, that it actually improved patients' mood state. And so we started using ketamine as a relatively easy, legal kind of medication treatment with psychedelic properties for treatment of depression. So we started that here at UBC back in 2021. We were kind of bored in the middle of the pandemic, didn't know what else to do. So we came up with this protocol that we started implementing. And so nowadays, we've got it inpatient, we've got it outpatient available as well. It's a small program, but it is part of the public system, so people don't have to pay for it. And it's pretty cool. We try to be really straightforward and reasonable with it, not to go into kind of unusual or soft, pseudo-spiritual kind of realms, and use it with some objective-based measures to make sure that we can help individuals with depression who are stuck in that kind of mind state to get out of that.
Okay, and so moving on, like what big change do you think you'll see in your field or with your ketamine program? Like what changes do you think will happen in the future?
In the future? Hard to know exactly what will happen, in the future, but let's say, in the next 10 years, what would be kind of neat? Well, on the neuro side of neuropsychiatry, such as brain injuries, neurological disorders, dementias, I think a lot's happening. We're starting to understand the biological mechanisms behind all of that in ways that are totally brand new compared to when I started in this field. How the networks are coordinated when it comes to thought and feelings are things that functional neuroimaging is starting to tease out these days. And hopefully this will allow us to develop techniques and technologies to activate those brain regions that might be dysfunctional. Fields like genetics, protein folding, metabolomics, that is understanding the cell's energy production mechanisms, in time I think could be very powerful for mental health. And for sure there are still conditions these days that we don't know exist in those areas like genetics that I think in the future we might currently call mental health related, but could be shifted to being a type of genetic disorder that we can better understand. We also can't not mention that intersection between AI and medicine, right? At UBC, we're actually starting a psychiatry AI collaboration program to see if we can develop tools to help us diagnose as well as enhance clinical assessments of patients, maybe even treatments also one of these days. And like with any technology, there are both positives and negatives about AI as it affects relationships and companionship and social connectedness. But I think, there are great potentials in mental health to harness these benefits while trying to keep away, the negatives of these technologies. And it's interesting, right? For the first time in human history, we're starting to see very powerful technologies that mimic human thought and how that will change our society and our emotional health.
Are there any big misconceptions about your field of work?
Well, let's see. I guess misconceptions. First of all, in mental health, there are of course all kinds of misconceptions we could talk about. But specifically as psychiatry, I guess I'm one of those prototypical shrinks we talk about in society. And the guys who talk about feelings and such and treat that. I think the main thing I would say is that there is this idea that we as psychiatrists like to push pills. The reason why I say this is because when I go to psychiatric conferences and stuff, you will often have groups come together and have protests about psychiatry and pushing ADHD meds on kids and those kinds of things. Obviously, there is going to be some kind of a medical component and medication component to psychiatry. But I think these days, most of us psychiatrists aim for a much more holistic model of mental health. While there are these biological conditions, most of what I do actually is psychological in nature, talking about how we think, how we feel, how we understand our social relationships. And even to some extent, I would say that there's a spiritual element to what I do in my day-to-day job, because I want to touch with people on things like meaning in life, fulfillment, values, attainment of not just knowledge or something concrete like financial wealth, but also the word wisdom of negotiating this complex world. It's not a word that we use very often, almost anywhere these days. Sometimes it's short, like I might see a patient for weeks or months, but sometimes I see these patients for years. One of the privileges of medicine, as I mentioned earlier, I think, is to be able to walk alongside with other people in their times of need, to understand them, in all these dimensions. In psychiatry, being seen as one who understands the patient's biological, psychological, social, maybe even their spiritual needs. It's a lofty ideal, to be sure, but I think all of us in mental health think about these things, and I think we hope that society will see us more along those lines. To be honest with you, I think all of medicine hopefully sees all doctors in those lines as well, right? Because there are all these paramedical kind of areas, where they kind of touch on those things, whether it's faith healers or homeopaths and naturopaths and such, which are very different from the science of medicine.
And so finally, if you could give one piece of advice to a high school or undergrad student considering medicine, what would it be?
Okay, all right. Okay, interesting. Okay, so I think I'm going to answer that a little bit in an unorthodox fashion. I'm not sure. I don't know what your other guests have said. But here it goes. Even if you are sure you want medicine today, I'd advise you to make sure to keep your mind open, right, as either an undergrad or a high school student. And make sure to take some courses out of curiosity in university. Looking back, I don't believe I was as free to think and have access to the time and opportunity to interact with others, like students, professors, as I was in those first 2 years in university before I wrote the MCAT and decided to, spend more time focusing on getting to med school. And looking back, I really appreciate the English literature courses that I took, the psychology, the social sciences, anthropology, comparative religious lectures that I attended. Because, as time goes on, as you get to know kind of the sciences and maybe even the limitations of science, those are the things I reach for to kind of give me, to kind of give me a sense of where else I want to go, how else I want to be creative in my thought and even with patients. So make sure to explore intellectually when you can for two reasons. One, you might actually find something more suitable for your character than medicine. You might find that. And two, I believe to be a good doctor, like with any other demanding career, it will bring with it sacrifices and responsibilities. So make sure to cherish the freedom you have in those early years. Not to say that you won't have freedom later on, just that the responsibilities later on in life are themselves the consequences on the freedoms that you act on earlier on, in your profession. So for example, taking the freedom to, say, open up a new medical office will result in the responsibilities of running it. Having the freedom to work with patients to prescribe and to treat their conditions brings with it the responsibilities of following up with patients and making sure that you do a good job. We are privileged to have such options as medical professionals if you become a doctor one of these days. Make sure to enjoy the intellectual freedom you have early on before those responsibilities come.